Fatima, come on up. She's a University of Central Florida, and she's a rising junior, and she works in the stroke and applied neuroscience lab of Dr. Levitt and team. Come on up.
Hi. I hope you guys are still awake and aware. My name is Fatima Alziyad. I worked at the SANS lab this summer, and today I'll be presenting on acute ischemic stroke biomarkers, a developmental technique to diagnose acute ischemic stroke rapidly. Did you know that someone in the world suffers a stroke every 40 seconds? Imagine if one of those strokes happened right now in this very room. What would you do, and how would you be able to recognize it? I'm sharing this not to scare you, but to highlight the urgency. In 2021, stroke accounted for approximately 1 in every 21 deaths in the United States. This underscores the importance of awareness and timely intervention. What the freak? Oh, sorry. I'd like to start with defining what an acute ischemic stroke is. An acute ischemic stroke is characterized by the sudden interruption of blood flow to a specific region of the brain. This disruption of blood supply results in a corresponding loss of neurological function in the affected brain region. I like to think that neurosurgeons are the plumbers of the medical field. If the pipes are clogged, you call a plumber. When your brain's clogged, you call a neurosurgeon. The difference, plumbers don't make $1 gazillion after. Now, how long do you think it takes to diagnose a stroke? Well, you go into the hospital, your history and symptoms are taken, the stroke team is notified as your neurological exams are being performed, your labs and imaging are performed, you get wheeled to get imaging, and your imaging has to get interpreted. You want to give time for your blood results to come back, and this can take anywhere from 45 to 60 minutes. That can take a while, but it is even longer after having cardiac surgery performed. Diagnosing a stroke after cardiac surgery can be challenging due to symptom overlap with other post-operative complications and potential imaging difficulties. Consequently, our focus is on identifying biomarkers in patients undergoing cardiac surgery. So, we want to find a way to try to reduce diagnosing a stroke. So Dr. Levitt, a cerebrovascular neurosurgeon, who oversees active stroke patients, got together with Dr. Burke, a cardiothoracic surgeon who oversees the cardiac patients, and they also got together with Drs. Hoofnagel and McCoss from Genomic Sciences and Pathology, and they discussed finding specific biomarkers to detect acute ischemic stroke early. They decided that their research team, me, would gather blood and urine samples during aortic arch replacement surgery and for active stroke patients. The goal is to monitor these samples for any changes that could indicate a potential stroke. So this summer, I had the opportunity to watch and learn how to consent patients in clinic. So for our study, our patients had to be 18 or over, they had to be undergoing elective aortic arch replacement surgery, they had to have no history of stroke or complications with MRI. So Dr. Burke would send us his patients and we would screen, and if they were eligible, then we would go to UWMC and consent patients in person, and we would explain in a clear manner what they're signing up for. So why are we focusing on aortic arch replacement surgery in specific? This is because during aortic arch replacement surgery, deep hypothermic circulatory arrest is being used. Deep hypothermic circulatory arrest is a technique used during complex surgeries to temporarily stop blood circulation and cool the body to very low temperatures, often below 20 degrees Celsius. This cooling reduces metabolic demands and helps protect vital organs by minimizing ischemic damage. However, this process can affect blood clotting mechanisms, potentially increasing the risk of bleeding or thrombosis. So patients undergoing this surgery are at a high risk of developing a clot. We can think of clots like little blocks that float in the blood. If one of these blocks breaks free and starts floating through the blood, it can get stuck in a small pipe leading to the brain. When the block gets stuck, it's like blocking a tiny tunnel going to the brain, and that's what happens in a stroke. So this summer, I collected blood and urine samples at the day of surgery, post-op day 1, and post-op day 3. for the cardiac cohort. So we are using this as a comparison against active stroke patients at Harborview. So we collected 6 blood samples at various points during surgery and recovery to capture pre- and post-surgical blood. We would centrifuge the blood samples and place them in a negative 80 degrees Celsius freezer. We also collected 2 urine samples before and after surgery. The reason we did this was because if a patient has a stroke throughout their inpatient stay, we can use our blood samples as a method to understand when the stroke occurred. By comparing all the blood samples, we hope to identify any significant changes in protein levels, and this comparison will help us detect specific biomarkers that could indicate acute ischemic stroke. Why is looking at biomarkers so relevant? Biomarkers are already being used as a diagnostic tool in many other disorders like myocardial infarction. A troponin test is used, and in deep venous thrombosis, a D-dimer test is used. However, there is no diagnostic test using biomarkers for acute ischemic strokes. So do you guys remember at the start I said it takes 45 to 60 minutes to diagnose a stroke at the hospital? We're trying to reduce that time of diagnosing a stroke. So we are looking at many different biomarkers, and these are relevant biomarkers that other studies have looked at that we can use as a reference. We're also using new biomarkers that we're looking at that haven't been looked at before. We're hoping to find a universal identifier that can help us reduce diagnosis time in a hospital. So it's still an ongoing study. We're still gathering blood and urine samples from patients, and we do hope to find a single identifier. For future applications, we hope to improve education for future generations about strokes and the importance of early detection because timely intervention is crucial when it comes to stroke. We hope that our research can support our future patients and families. We hope that we can make this technology more accessible to underrepresented communities. And I'd like to say thank you to Mrs. and Dr. Ellen Bogan for having me here this summer. I'd like to say thank you to Dr. McDonald. I'd like to say thank you to Dr. Levitt and the collaborators of the stroke biomarker study. Thank you to my lab mentors, Ashton and Keiko. Thank you to my lab partners, Michelle and Nate. And thank you to Airlift Northwest, because I went to a helicopter this summer. You see the picture? That's me. But thank you so much.